girl in Australia is fighting every single day. Because the condition she was born with has caused her tongue to grow so large that it blocks her airway and drops her oxygen levels to dangerously low levels while she sleeps. Her name is Lulu. She is just a few months old, and she is one of the bravest little people you will ever hear about. This is her story. Lulu was born in April in northern New South Wales, Australia. Even before she arrived, her family's journey had already been extraordinary. When her mother Daisy was just 24 weeks pregnant, she was admitted to hospital with serious complications. To keep the family together, Daisy, her partner Chris, and their two young sons, Zephyr and Kai, they moved into Ronald McDonald House, where they stayed from Christmas until Lulu was born at 36 weeks. During that time, Daisy was largely confined to a wheelchair. Chris cared for her and the boys. Zephyr had to change schools to stay close to specialist care. And then Lulu arrived, and the real fight began. Following her birth, Lulu was diagnosed with Beckwith-Wiedemann Syndrome, known as BWS. It is a rare genetic disorder that causes abnormal growth in various parts of the body. It affects approximately 1 in 10,500 births, making it one of the rarest conditions a family can be handed. Children with BWS can experience overgrowth of organs, increased risk of certain childhood tumors, and a range of complications depending on which parts of the body are affected. In Lulu's case, the most immediate and dangerous effect has been on her tongue. Lulu has been diagnosed with severe macroglossia, a medical term for a tongue that has grown significantly larger than normal. In Lulu's case, the enlargement is so pronounced that it interferes with 3 of the most basic things a baby needs to do: breathing, feeding, sleeping. Her tongue physically blocks her airway, making each of those tasks a daily battle. Family friend Chloe Baker, who launched a GoFundMe to support the family, described Lulu as relying on oxygen delivered through nasal tubes just to breathe safely. It is, she said, a constant reminder of just how much this tiny little girl is fighting every single day. The full severity of Lulu's condition became even clearer during a recent hospital admission, when a sleep study was conducted. The results were alarming. While Lulu slept, her oxygen levels dropped to just 50%. A healthy baby should maintain oxygen levels of around 95 to 100%. 50% is critically low, and the cause was her enlarged tongue physically blocking her airway as she slept. Doctors diagnosed Lulu with obstructive sleep apnea as a result. She now relies on supplemental oxygen through nasal tubes around the clock, and is expected to remain on oxygen therapy until she is able to undergo surgery. As if that were not enough for one tiny baby to carry, further investigations revealed additional complications. MRIs and ultrasounds showed that Lulu has multiple haemangiomas throughout her liver, non-cancerous tumors that, while not malignant, can affect liver function and lead to further complications including rapid breathing, feeding problems, poor weight gain, and jaundice. Doctors are monitoring them closely. Every appointment carries weight for a family already carrying so much. The most significant medical intervention on the horizon for Lulu is tongue reduction surgery, a procedure that would surgically reduce the size of her tongue to allow her to breathe and feed more easily. Given the severity of her condition, doctors are considering bringing the surgery forward to give Lulu the relief she needs as soon as possible. Until that surgery takes place, Lulu's family will continue to manage her oxygen dependency, her feeding difficulties, and the constant vigilance required to keep her safe. The toll this journey has taken on Daisy, Chris, Zephyr, and Kai is immense. Chris has been unable to work since Christmas. The family's income effectively stopped the moment Daisy was hospitalized during the pregnancy. Daisy devotes her days entirely to Lulu's care and the management of a constant stream of medical appointments, hospital stays, and interstate travel. The family lives in northern New South Wales, but Lulu's specialist care requires regular trips to Queensland Children's Hospital in Brisbane, more than 3 hours away. Every 3 months they travel for scans and blood tests. Every month, Lulu needs thyroid checks, and in between, the daily management of a baby on oxygen with an enlarged tongue, liver tumors, and sleep apnea. Chloe Baker described the family as living a reality no family should ever have to face. She is right. A GoFundMe campaign has been launched by Chloe Baker on behalf of Lulu's family to help cover medical expenses, travel costs, accommodation in Brisbane, and everyday household costs that have become impossible to manage without an income. If you would like to support Lulu, Daisy, Chris, Zephyr and Kai, search for the GoFundMe page for baby Lulu with Beckwith-Wiedemann Syndrome in NSW, Australia. Every contribution helps a family focus on what matters most, their little girl. Baby Lulu was born in April. She has spent more of her short life in hospital than out of it. She breathes through tubes. She fights every single day just to do the things the rest of us take for granted. And behind her, every step of the way, are a mother, a father, and two big brothers who have already given everything they have. Lulu is tiny, but she is fierce, and the whole world is rooting for her. If you found this story moving, please subscribe so you don't miss our next update.